Hey shipmates, this is Vice Admiral Matt Nathan, Navy Surgeon General, and I want to talk to you about something that has been front and center in the news lately. I want to talk about the Ebola cases that are showing up in the United States that are in the forefront of our consciousness right now, and rightly so. Ebola is a deadly disease and has visibly ravaged countries in Western Africa. Nothing is more important than the health and well-being of our people, and Navy medicine is committed to providing quality care and ensuring the safety of our sailors, Marines, their families, and all of our beneficiaries. We are actively working with the Centers for Disease Control to ensure steps are being taken to contain, control, cure, and prevent this disease both in the United States and around the globe. I've asked Commander James Lawler, one of our Navy infectious disease specialists, to come today to talk a little bit about the Ebola virus. He's researched Ebola in the laboratory settings and has worked in the treatment centers in Africa. Earlier this year, he worked with the World Health Organization and Doctors Without Borders in the Ebola treatment unit in Guinea.
Ebola is scary, and I understand why people are concerned. However, despite what you might see on TV or read on the web, the risk to our service members and families here in the United States is extremely low. You cannot contract Ebola unless you come in close contact with somebody who is sick with the virus. We know it is much less infectious than many other communicable diseases, such as influenza or the common cold. Keep in mind, the only cases contracted in the United States were nurses who directly cared for a critically ill Ebola patient. When we use the appropriate infection control practices, we can prevent transmission of the disease. If you become ill and seek treatment at a military health care facility for whatever reason, don't be surprised if people are asking extra questions and using extra protocols. Keep in mind, our military health system is implementing additional protocols to protect against Ebola. Our civilian and military medical professionals will do everything they can for you. Please calmly comply with their directions, answer questions about travel and contacts honestly, and remember that the caregiver and patient relationship is a team effort. If you are a service member returning from recent travel or deployment to affected areas, it is critically important for you to alert the healthcare team in order for them to provide you with the best possible treatment.
Thanks, Dr. Lawler. So the information he presented is your first line of defense. Being smart and having awareness of what and who you come in contact with is of the utmost importance when dealing with the prevention of infectious diseases. For our sailors and Marines who are deploying to West Africa, I want to reassure you, we will provide you with the training, the personal protective equipment, and preventative medicines necessary to protect you from Ebola and any other infectious diseases. Pay attention to your training and be smart. If we stick with the plan, I am confident we can conduct our mission safely and effectively. It is critical to keep your risk of Ebola in perspective. And with flu season upon us, it is also important to remember the basic steps that protect us all against infectious diseases, such as hand washing and using common sense when sneezing and coughing. I'm much more worried about influenza taking lives this year in our country than I am about Ebola. But that doesn't mean we can't be smart and pay attention to where we've been and who we've come in contact with. Navy medicine is committed to protecting and restoring your health. Help us help you. As always, it's a privilege and an honor to serve with you.